The ANOCs are coming. The ANOCs are coming. Hey everyone, Gary Owen here. While we're not back in 1775 being invaded by the Redcoats, thank God, during this month, September 2025, your mailboxes are going to be invaded by ANOCs. It's true, folks. Medicare beneficiaries will soon be receiving their annual notice of change by the various insurance carriers, and it is absolutely important that you read this carefully, especially since the two largest Medicare Advantage carriers, United Healthcare and Humana, announced that they are going to be terminating nearly 1.2 million Medicare Advantage plans. But we'll get back to that in just a moment and what that means to you. First, I want to answer just what an ANOC is, the annual notice of change, and how it affects you. So every year, right around September, Medicare members who are on a Medicare Advantage plan or a prescription drug plan will receive this ANOC letter, which notifies them about key changes that will take effect in the next plan year, which is January 2026. So if you're on a Medicare Supplement plan or a Medigap plan, the good news is you are not going to receive this ANOC letter, and you don't need to do anything unless you do have a specific concern about your Medicare Supplement plan, like a double-digit increase in premiums, which we have seen from multiple carriers here recently. One thing most people don't know is that if you are on a Medicare Supplement plan, you don't have to wait until the AEP or OEP to enroll in another supplement plan. You can do that any time of the year. But again, you'll most likely have to qualify with that new Medicare Supplement plan by answering health underwriting questions. So we'll talk more about that briefly as well. There are typically 8 core categories of information that will be detailed in your ANOC letter. So the first is your monthly premium. So any increase, decrease, or elimination of the monthly premium, you'll be notified of. 2, deductibles and cost sharing. So changes to annual deductibles, co-payments, or co-insurance for medical services and for prescription drugs. 3, drug coverage, or also known as your formulary. Updates, which prescription drugs are covered, there could be added, could be removed, or tier levels could be moved. So the tier level that you had last year could be a tier 1, now it could be moved to a tier 2. 4, pharmacy network changes, modifications in preferred, standard, or out-of-network pharmacies, which can certainly impact your drug costs. 5, provider network changes, whether certain doctors, hospitals, or specialists will no longer be in the plan's network. Again, that's related for Medicare Advantage plans, not for supplement plans. 6, coverage rules and benefits, adjustments to covered services, prior authorization requirements, quantity limits, or step therapy rules. Number 7, the MOOP limit, or the maximum out-of-pocket. Updates to the annual cap on how much the beneficiary will pay for covered services before the plan covers 100%. And we've seen some new plans for 26 up to $12,000 out of pocket. Number 8, this is the big one. Plan termination notification. You will receive notification that your plan is being terminated. This means that you must enroll in a different plan by December 31st. So regarding points 1 through 7, if you don't like the changes to your Medicare Advantage or your PDP plan, or if you simply want to seek out another type of Medicare plan that may be a better option for you, you can do that during the AEP, or the annual enrollment period, from October 15 through December 7. And your new plan takes effect January 1. But if your ANOC notifies you that your plan is being terminated, then this is really good news for you if you're on a Medicare Advantage plan now, and you have until December 31st to make a change. Again, for a January 1 effective date. Now let's review what happens when United Healthcare and Humana, and of course any of the other Medicare Advantage carriers, when they terminate these Medicare Advantage plans, and if you're the one receiving this ANOC termination letter. The reason why I say it's good news is because it is good news, because for most people who are on a Medicare Advantage plan now and want to make a change, they would typically have to qualify with and pass health underwriting questions from their respective Medicare Supplement carriers. And many pre-existing health conditions can preclude you from qualifying with that new Medicare Supplement carrier, that plan. However, because you now have this ANOC letter in hand that indicates that you're being terminated from your Medicare Advantage plan, you now have a guaranteed issue right to select a Medicare Supplement plan. It's a guaranteed issue, folks. That's right. So no health underwriting questions can be asked. So if you're not wanting to go back into managed care again with a Medicare Advantage plan, then this is probably your one opportunity to get back onto original Medicare and pick up a Medicare plan, a Medicare Supplement plan, and a standalone PDP plan. Listen, I can't tell you how many times clients receive this ANOC letter and they discard it or they don't read it carefully. Then when January comes around, they go to their doctor and then find out that they don't have their Medicare Advantage plan anymore, and they missed their opportunity to enroll during the AEP, and they missed their opportunity to enroll in another MAPD plan or a Medigap plan. So you'll also want to be sure to keep your ANOC letter so that the agent who is assisting you can upload that to the carrier to prove that your plan has been terminated and you have guaranteed issue right into that new supplement plan. So folks, there you have it. In spite of the fact that the ANOCs are coming, you can do something about it. If you have questions or you need help reviewing your current plan, or if you want to be enrolled in a more suitable plan that fits your specific needs, then hey, reach out to your local agent, or if you are not working with a Medicare agent, then we'd be happy to assist you with your Medicare insurance planning needs. Folks, this is absolutely important stuff, and you need to be sure it gets done correctly. Do it right the first time. As independent insurance agents, we do not charge for our services. That's correct. We do not charge. So you have nothing to lose by giving us a call. We're very proud to be members of MedicareJourney.org, a national nonprofit. We're certified Medicare insurance planners and recipients of NAOSA's Best Independent Agency Award. We have nearly 500 agents nationwide from coast to coast that can assist you, and we are not a call center, guys and gals, but we are a professional and ethical brick and mortar Florida agency licensed in 42 states. So give us a call today at 772-210-1020 or toll free at 833-693-6467 to schedule your confidential and your complimentary Medicare review. You can also go to our website to learn more about us. Below, it's OwenInsuranceGroup.com. Pick up the phone today and give us a call. We look forward to working with you.